In this week's video I will show you the retrocalcaneal bursa on MRI, and we will have a look at when it's a bursitis and when it's just a normal finding. So before we start, just have a look at this image here and make up your mind whether you think this is a bursitis or not. So I will scroll through slowly here, making this one bigger. Also show you the transverse sections here. Okay, we will come back to this case later. Now this is another case, and you can see this time we have clearly an abnormal amount of fluid in the retrocalcaneal bursa here, and it has this funny shape with these two arms here and reaching a little bit down here, which is also normal. So it sits over this edge here and therefore making the gliding of the tendon and the fat pad over the bone here smooth. Now in this patient, this is clearly a bursitis. We have way too much fluid. In addition to that, we have a synovitis and then joint effusion here in the ankle joint and also here along the tendons. And this one here is now after gadolinium administration, and you can now see that the bursa is enhancing, which it normally does not. So therefore it's a very straightforward diagnosis of a retrocalcaneal bursitis. This one here is another case, and again, as in the previous one, you can see the amount of fluid is way out of proportion. And in addition to the bursitis, we have a partial tear of the Achilles tendon at the level of the insertion. So now all this way down here, this is way too much. So the fibers here, the anterior ones are torn, partially torn, and the superficial ones here are still intact. And together with this tear, we have an associated bursitis. Also this one here, straightforward case. And here another case, this time with some tendinosis. We might have a interstitial tear here and some enthesiophytes. And again, we have here this bursitis, and you can again see if we go to the lateral side, it has this funny shape with these two arms, and going medially, then we have this fluid-filled sac here. And the amount of fluid just based from eyeballing is clearly abnormal and therefore a bursitis. So this is now another patient that had not pain in this region, and you can see we don't have a really relevant fluid collection here, but we can still see the bursa. We have a tiny amount of fluid here with this tiny dot here. So this is clearly still in the range of normal. And if you compare this with the previous cases, you get the impression when it's abnormal and when it's normal. Sometimes you don't see anything at all, but just keep in mind that a tiny amount of fluid can still be normal, especially if there's no pain or other associated findings. Now coming back to our first case here, and you can see this time we don't have as much fluid in the bursa as we had with the other cases, but we have a little bit more than in the one that I just showed you before, which was normal. So how can we say that this is now still in the range of normal, or whether this is a bursitis? And luckily for us, there was a study about that topic in 1997, so a very old paper, that assessed the MR imaging of the normal and abnormal retrocalcaneal bursa. And what they did, they had like 50 ankles of 25 asymptomatic volunteers and 30 ankles of patients with actual Achilles tendon disorders, and they just measured the size of the bursa. Now we can go and see how they measured it. I think they did in 3 different dimensions: anteroposterior measurements and craniocaudally and the transverse measurement. And then they show here this amount is normal, and the second image, this amount is way too much. Now that's so far so good. Now if we go to the results, you can see that the normal or the asymptomatic volunteers had average or mean bursal dimensions of 1 millimeter in the anteroposterior dimension. So the average was 1, however the range was just 0 to 1 millimeter. So the authors then conclude that anything above 1 millimeter in the anteroposterior dimension can be considered abnormal. Now the transverse diameter measured on transverse sections horizontally can be up to 11 millimeters with an average of 6. It's not really a helpful measurement in my opinion. And then we have the craniocaudal dimension, which can range from 0 to 7 millimeters with an average or a mean of 3. And then they also measured all the pathological stuff here with higher ranges and higher means, which is quite obvious. Now let's jump right to the conclusion. So we suggest that bursal dimensions greater than 1 millimeter in the anteroposterior dimension, 11 millimeter in the transverse, and 7 millimeter in the craniocaudal dimension might aid in identifying retrocalcaneal bursal disorders. Just a quick Patreon update. First, I'd like to welcome Nazar, who is a new patron. Hi there, thanks for your support, and also thanks to Ruben, a long-standing patron of mine, who increased his pledge from $10 to $20. So thanks a lot to Ruben as well. And if you want to know more about Patreon, and if you want to get exclusive content every month, then just check the link down below, and I would be really happy if you would join our campaign. So let's go back to our first case, or the initial case that I have shown you. And now, if you see this, you might be inclined to say it's just a normal amount of fluid in the bursa. Now, I gave you the measurements, and although image quality has improved a lot and the measurement bias or error in that study, in the mentioned study, was probably high or higher than we would have it nowadays, if we do the measurements, we get here maybe up to 8 millimeters, so this is higher than the threshold of 7 millimeters mentioned in that study. We can also measure the AP diameter, which is up to 2 millimeters depending on your measurement technique, so also a little bit too much. And we can also try to do this on the transverse sections here. Measure the transverse diameter, and we would get something like close to 11, depending on where we measure and how far we measure, maybe up to 12, also a little bit too much. And whilst we are here, we can also try to measure the AP diameter one more time, just to make sure we are measuring it correctly. So it's up to 2 millimeters. That means that based on that findings, this is actually a little bit too much and can be considered abnormal. Now it's a little bit borderline, I admit, but we have other signs that can guide us in this patient. So one thing is, you can see here a tiny amount of bone marrow edema in the calcaneal bone here, in the calcaneus. This is a little bit too much, and also here along the paratenon of the Achilles tendon we have some edema, potentially also in the subcutaneous soft tissue. And we have a second bursa here, which is the subcutaneous calcaneal bursa, although I never really see a lot of fluid in that bursa anyways. So might also be just a paratenonitis in this setting here. And together with all this, with the just a little bit over our limits amount of fluid, bone marrow edema, and this subcutaneous or paratenonitis here, we can say this is abnormal and potentially a very subtle bursitis. Now the patient has pain up here just behind the medial malleolus, so we are not really having the issue here. And this is probably sometimes the case where patients have a lot of friction and stress here, but not on a level that bothers them or that is even clinically manifesting itself. But it's just like a subclinical bursitis. So that might be a term we could use in something like that. If we wouldn't have this edema here, and if we wouldn't have the bone marrow edema, I would just say, although the amount of fluid is a little bit higher than what's been measured in that study, I would still say it's probably just normal. Please let me know in the comments if you have a different opinion and give an argument why you think this is just normal, or if you argue in the direction that it's probably a bursitis, because these discussions are really helpful, because these borderline cases are really what people, and also me, struggle with the most, right? It's not the easy cases or the very impressive cases that are difficult to deal with. And with that, thanks for watching, and hopefully you come back next week.